Welcome to Chat with Dr. Kat. This is Dr. Kat. Nice to see you today. Today we're going to be talking about teenagers and families. Huge issue. So many different things we can be talking about with teenagers and what we're seeing in our world today, in our communities and in our homes with teenagers. Today we have a wonderful guest today, Chris Fulton, who is a psychologist and an absolute expert working with teenagers and families. So sit back, get ready for wonderful information about your teenagers. Some difficult things to hear, some positive things to hear, but definitely some tools and skills to walk away with today. So, as always, no fluff, no judgment, just real talk that leads to real change. Welcome, Chris. How are you doing today?
Doing great. Thanks, Kat.
So let's start with just telling me about your practice, telling everybody about your practice and what you do.
Sure. No, I've been in Calabasas for about 30 years and started a group called Fulton Psychological Group, and kind of did that based on I'm a huge collaborator, and I remember trying to get a hold of people, and it was always kind of difficult. So I said, you know what, I think I'm going to try a one-stop shop, and so I have people here who are do medication, they do testing. I got educational consultants kind of help people, figure out what's the best school for their kid. The testing helps with, screening ADHD or learning differences. We do individual, group, and family counseling. And I even have a couple life coaches. We do little executive functioning because one of the things that we're seeing more of is just executive functioning issues, a lot more ADHD. And even at the college level, we have a guy who basically kind of helps the college students stay on track to make sure that, they're planning and they're organizing and they're remembering things. And we even do some performance psychology. So we have a lot of people who are trying to become, high-level athletes.
Mm-hmm.
In fact, I was working with someone yesterday, a kid who's 11, just on making sure he stops breaking tennis rackets on the tennis court. So we help even our high-performing athletes and performers.
That's great. So that's not like the normal practice. That's what really does make you different, is because normally when you do go to private practice, you see, one clinician, and then it's really everybody's individual businesses within one suite, even if you go to one that have multiple people. So the fact that you have this kind of one-stop shop for a lot of things makes it easier. Why do you, obviously I know why it makes it easier, but tell us, why does it make it easier to have this one stop if you need medication or you need a coach or you need something else? Why is that important?
It's basically collaboration. My training was community-clinical psychology, and so it was really about getting a whole community to help a child. And so I just came into private practice with that mindset. And so I'm like, okay, I need to have like a whole community that will actively collaborate and be able to talk, left hand has to talk to the right hand. And that's the other thing, is we make sure to include parents. A lot of times you go to actually practices where you take your kid and the therapist won't talk to the parents. They're like, oh no, I got to have a completely private relationship. And I make sure that the kids have some privacy. But at the same time, I always tell parents, one of my favorite lines, you'll love this. I go, hey, to put me out of work quicker, you need to do X, Y, and Z. And then if you do these things, you're going to create job security for me. So why don't you, cut that out over there? So I'm always telling parents, I go, I got to give you guys tools. And so it's collaboration among, professionals, and it's collaboration among parents. And even we'll reach out to teachers. I have a lot of pediatricians and school psychologists that make referrals because I work with them, I'll call up my pediatrician, friends and be like, hey, you got Johnny here, he's got these stomach aches. I'm trying to make sure there's nothing physical, and that's actually a sign of anxiety. Because a lot of times the first symptoms of anxiety or depression are physical, not emotional.
Right. And I practice this way as well, because I always feel like if you are working with an adolescent, you're getting a lot of perception, just what they think is going on. And if you don't talk to those parents, and I do respect other people's, how they decide to run their practice, but I do think it's so valuable, because when you do speak to that parent, you are getting the other side that could be fueling the child to go into that other direction or keeping them maybe in that depressive state. We
Yeah.
never know what's going on.
Yeah.
I'm glad that a lot of more clinicians are doing that more and more. When I go to conferences, I'm hearing a lot of pushing for that. Whereas before, it was a lot of, you're just speaking to the child. You want to give them complete confidentiality, which they should have.
Sure.
And
Absolutely.
right? And you can speak to parents by still maintain those boundaries and even come up with what you're going to say or ask with the parents, with that child. So what
Yeah.
are some of the things that you're seeing out there right now with teens and families?
It's interesting, COVID was a big, it just came in and blew up all of the society and some of the norms and where we saw things going. And I think it fast tracked some things that we were going to eventually see, like excessive computer time and screen
Hmm.
time. We were already seeing that it was moving, and then COVID just said, "Here, we're going to put this in light speed."
Oh yeah.
And so we're just seeing kids getting isolated. I'd say
Hmm.
isolation would be a key term right now that I'm seeing, and alienation, where kids aren't going out and doing things. They don't go out on the weekends as much and hang out with their buddies or their friends. They don't go to parties, their interactions at school, and then it's always kind of structured activities, like
Hmm.
sports or drama and things like that. So a lot more isolation, which then leads to anxiety and depression, and more identity confusion. Kat, you know this as much as I do, that the top reason or correlate with mental health is perceived social support system. And if you don't
Right.
have like your peeps, you just don't function as well. So we're just seeing a lot more isolation that then leads to secondary issues of depression, anxiety, and then even identity. We're seeing a lot more identity issues.
A lot more. A lot more. Yeah.
Yeah, and it's broader. Before there would be certain categories you try to figure yourself out. You're either like the brainiac or the stoner or the
Hmm.
jock. Now those categories are like, there's like
Huge.
dozens of them, right?
Yes.
So it's almost like going to a restaurant and there's like too many things to order, It's like I don't even know where to start.
Yeah, we are definitely seeing a lot of different things. And then we're seeing, I don't know if you're seeing this or not, but while these kids are starting to navigate and decide, okay, well, do I fit in this category? Do I fit in this
Hmm.
category? And sometimes parents are becoming too permissive, and you want to be
Hmm.
supportive. But,
Hmm.
if your kid's going to come up to you and say, at 11 years old or even at 15, say, hey, I want to get a face tattoo across my
Hmm.
forehead. Well, you're,
Hmm.
you're not going to allow that. But
Hmm.
sometimes
Hmm.
these other issues, it's just allowing kids to
Hmm.
do some of these extremes. What do you think about that?
Hmm. It's interesting when I get kids who are coming in and they're pretty early on trying to, look at these extremes. I kind of look at it like, hey, is there an identity or validation issue
Hmm.
more than, let's say, a gender issue, gender identity? Like, is it a more of a validation? Like, I want to feel important. I want to feel like I matter. I want to feel like people care about me. I want to feel interesting. So I really try to look at core issues and then say, hey, how can we address those and make you feel important and valuable and worthy? And then we'll go to the secondary, like, what are your interests? And, is there a gender identity issue and things like that? So I really try to go to core before making huge decisions about, let me change this or change that about my exterior.
So, what are some of your go to interventions that you have with teens?
I'm a cognitive behavioral therapist and a family system. So I'll get to the family systems. We'll talk about that in a minute. But really, the cognitive behavioral, it's kind of funny, Kat. I have really, like, through my training, through my kind of looking into all different philosophies, it all comes down to the same thing: perception.
Hmm.
That your perception is your reality. So what I always try to look at is like, hey, you know what? If you perceive this situation to be dangerous, you're going to have anxiety. And so I'm always looking at like how you perceive things and get people to change, that perception. And that will change how you feel and then how you act. It's kind of like a flow chart, you know, event and then how you look at it. And then based on how you look at it is going to determine how you feel about it. And then it's going to determine what you do about it.
Mm-hmm.
And so I always go back to the interpretation. So reinterpreting things is like not catastrophic. A lot of times people commit that cognitive error of catastrophic thinking or future tripping or what ifs. And so really attack that and go, hey, let's really look at this and let's get some data points. Do these data points support this interpretation, or do we have some other data points that support a different interpretation? So it really comes down to how you see it.
That's great. You know, People need to feel that there's something that they can leave with. That's some of the
Mm-hmm,
feedback that I have been receiving through just doing this podcast, is that people
mm-hmm,
ask a lot of questions and they come through and they say,
mm-hmm,
I just need something tangible. I'm in
mm-hmm,
therapy, but I'm not receiving something tangible. Or I get the
mm-hmm,
other, which I love, is these are the things that I'm working on now. Do you have anything more? And I think they're
mm-hmm,
constantly searching.
mm-hmm,
And with that, I want to ask you this. What are you seeing with AI in your practice?
mm-hmm.
What are you seeing there with families and especially teens?
Interesting. It's funny because I use AI. So, full disclosure, I use AI on a regular basis, whether it be, writing certain things. In fact, I designed a birthday card for my son, on AI. And I'm like, hey, let's go, come up with this birthday card. And we came up with this San Francisco design, sent it out. And what I'm seeing is a few things. When it first came out, what it led to actually was massive cheating. Like
Right,
kids were
exactly.
just using AI to basically, like, especially during COVID, they're like, oh, I'm just going to have AI write on my, papers and stuff like that. Well, then the teachers, caught up, and now they have programs that kind of test, how much is AI, being used and stuff.
Right.
And they're doing more in-class assignments. So that was kind of the first thing that I saw kids using. Now it's interesting. We're seeing it being used in multiple and deeper ways. Again, some of it's for school and things like that and writing stuff. But they have like certain chatbots and they have certain like AIs that are designed almost to be a companion.
Hmm.
And so what we're seeing is that people who feel isolated, back to what we're seeing more of, they use AI almost as a companion.
Hmm.
And I'm seeing it actually used as a therapist. In
Hmm.
fact, I've had, I'll ask some clients who I know who are asking AI, I say, hey, how's my competition? What are they saying about,
Oh,
what
yeah.
to do about
Hmm.
this situation? I had the first thing that happened to me the other day, a few weeks ago, that AI actually referred a client to me personally. I was like, how's that possible? I guess Perplexity had put me in there.
Uh-huh.
Um, and there's things that are helpful. Because I even use AI. I'll go, hey, listen, I have this type of client. What are some,
Sure.
these are some of the ideas, and it'll come up with other ideas in my treatment plan. So I'm not saying that it doesn't, it can't be assisting. But AI isn't a critical thinker, and it doesn't give you feedback. And so it usually is going to confirm more than it is going to challenge you. So if you say to AI, hey, I want to go join this group and do XYZ. Even if it's not necessarily the best thing, AI is going to sometimes err on the side of just being supportive. Like, oh, it's always good to join groups and find that social
Absolutely.
support system. And it won't be like, if you join that group, there's other people that might not like that very much, and so you get this almost false sense of confirmation, like what you're doing is all okay. So that is one of, I think, the perils of AI. And then what happens is it keeps them from going out to real world, situations and, interact with people. And then that creates more isolation. In really dangerous cases, like when you get kids who are, have more distorted thinking, they might have a pre kind of psychotic, kind of situation. It could actually start confirming that and not challenge enough. And then it really almost exaggerates distorted thinking. So that's when I get really nervous about it.
Yeah, I have been Definitely seeing a lot come into the practice, and it's true. I will have people say to me, "Oh, those interventions you gave me, or my homework, ChatGPT thought it was a great idea also." And I said, "Oh,
Hmm. Hmm.
wow, okay,
Hmm.
great. What else did you hear?" But it's true. AI tends to be very soft, not challenging.
Hmm.
And
Hmm.
if someone does have these thoughts and feelings, it's almost like lending itself to hear some other ideas. And
Hmm.
where I think it sometimes does challenge a situation I had with my daughter, and it was over
Hmm.
car insurance.
Hmm.
Excuse me. I had asked her a question and said, "Hey, I was talking to the insurance company. We just need to get, a copy of your good grades and, so on and so forth." And she comes back and she says, "Well, I checked with ChatGPT and she says that you are, confused about something." And I said, "Okay, now it's a she. And she's
Hmm.
telling me that I'm confused." And she sends me a clip.
Hmm.
And I thought, you know, she may be right, but the way it was put was so human and it was instantly on her side. And there really wasn't and your mom has a great idea getting your grades in because, it
Hmm.
reduces insurance. It was really just focusing on my confusion, which she was pushing
Yeah.
for. Now, I will say this, I did send that along to the insurance company, and it
Hmm.
was right. So
Hmm.
the person was said, "Oh, I didn't think about it that way." But I like that teenagers are using it as a tool. It is thinking outside the box, but how far? Because then it gives you
Yeah.
too much.
It can, and it's. I think it's better for like. It's funny when I was reading. Sometimes people go to AI and go, "I'm having a panic attack. What are some of the strategies to help me right now?" Okay, then it's going to come up with
Yes.
some good concrete strategies. In that form, I think it's helpful. I had a client who went and put in the information about his girlfriend and asked it if AI if I should break up with my girlfriend. I was like, that's a much more complicated,
Wow.
question that I don't think AI can answer. And AI, again, doesn't look at consequences of decisions,
Exactly.
too. It just looks at like, okay, this is, this based on this information and what it gathers, this is what the answer should be. But it doesn't really look at consequences.
That's a great point because that's the whole thing with teenagers. Most of the time, they don't
Hmm.
think of the consequences. Sometimes they
Hmm.
fear, punishment or a
Hmm.
consequence like that. But sometimes, they're not thinking of the true domino effect. Maybe they're going one layer
Hmm.
back of, "Oh, okay, my parents will be mad. I'll deal with it." But they're not
Hmm.
seeing the rest. Okay, so
Hmm.
this is a big topic, and I think that I have another episode that will
Okay.
be coming out with someone else that would talk about AI. So I think it might be
Hmm.
great for us, the three of us, to get together and maybe do another episode just focusing on AI with teens
Sure.
because
Sure.
it's a big issue. It's a
Hmm.
really big issue that I don't think parents are fully grasping
Hmm.
because of that
Yeah.
isolation that you've talked about in the beginning from the pandemic. I think everyone has tended to isolate more. I mean, I
Yeah.
think about myself, plus I think my kids are older now, and
Hmm.
so as you move through school age and into high school and things like that, maybe socializing even amongst the parents began to change. But it's still pretty big difference since the pandemic. And I see the trends even on my own social media with other people.
Hmm. Hmm. Hmm.
But bringing it back to the teens. So I think that would be a good idea for us to do that. So I'll let you know about that as
Sure.
well, because I think that would be a great
Great.
one. But let's go back to speaking about your practice in teens. So also, when teenagers
Hmm.
come into therapy, oftentimes
Hmm.
they don't want to be in therapy. I love the coaching
Sure.
angle. And
Hmm.
I've changed things here and there when somebody has reached out and I said, "Well, tell them I'm a coach. I am a
Hmm.
certified coach as well." So I said,
Hmm.
but if I go into that realm, I'm going to
Hmm.
stay as coach because I don't
Hmm.
flip hats back and forth. But
Hmm.
what are some things you do when you see teenagers and maybe even parents, if you could speak about both, that are stuck? They're stuck
Hmm. Hmm.
and unable to move forward.
It's interesting. There's two different types of communication, Kat, and one is the kind of manifest, like what is being communicated up here. And then there's a latent communication, what's down here. Like I had a client the other day who was sitting there saying that her husband was mad because he wasn't included in some, interactions and decisions. And the husband kept saying, I just want to, know exactly what's going on. I want to know, what's exactly going on. And the parents fought about what was exactly going on. I said, that wasn't the fight. The fight was about he wants to feel included. He doesn't want to feel left out. And if
Right.
you would have changed the conversation to what he was really communicating, then you would really get at what he wanted to be heard about. There's a good book, Anatomy of Peace, and it talks about like how you need to take other people's like perceptions, and you have to spend more time listening than just trying to speak your piece. So a lot of times when people get stuck, especially if I'm working with an entire family, what I'm doing is often getting people to hear each other.
Mm-hmm.
And I'll do exercises, literally just stop the communication and go, what did that person just say? What is it that they're feeling? And what are they communicating? And make sure that that gets across. So that's one thing in the families. Sometimes with the kids, if I'm just doing more individual work, I heard it was interesting. It was a podcast, and the guest was saying that if you can't take the existing step, that means that you need to make it a smaller one.
Mm-hmm.
And I always do that with people. Like I'll share a story. One time, my daughter, we were in Yosemite, and she was about 11, and she got terrified to go up this hill that was at Vernal Falls, and it looked like a scene out of like a thriller movie that like the gates are going to fall down and the railings are going to fall down, and she was just terrified. And I said, okay, so the first thing is you slow down their sympathetic nervous system. So this is what you do when you have like too much anxiety. So I just said, let's just breathe and let's just focus on that little flower. So it's called a grounding exercise.
Mm-hmm.
So we just got kind of grounded for a minute. And I said, hey, do you think that you could take that step right in front of you and step next to the flower? And she's like, okay. And she took that step. And I said, hey, what about the one next to the rock? And yep, boy, this took us forever to get up this hill. But eventually we got up there. And so what I do with people in therapeutically is I break everything into a really small step. If I'm dealing with someone who's doing school avoidance and they can't go to school, you know what that first step is? Can you have breakfast in the morning before school? Okay. Can you sit in the car? I'll have a kid sit in the car until they kind of get bored. And then I go, can you drive? We're not going to go to school, like inside, but we're just going to drive and hang out at the parking lot. And so then it's like we sit in the parking lot for a little while. So we call them exposure activities. Because one of my, I'd say, biggest interventions is expanding someone's comfort zone.
Mm-hmm.
Because our comfort zones have gotten really small. It's like, it's my computer and my gaming system and my room. And that's what I'm going to do this weekend. And so what I do is I try to expand it, and I do it through like mini exposures. And so when people get stuck and they can't like get out there in the world, I just do small steps. When people are having problems between each other, I make sure that they're listening to each other.
Mm-hmm.
And then if they're paralyzed by their perception about things, what we try to do is go, hey, how can you look at this a little differently? And what data do we have? Mm-hmm. And then if they feel incapable of doing something, I'm trying to get them to, let's say, go to school. What I do is maybe start referencing something that they are capable of. And I get them to see, like, I call it a model of success. So I go, hey, listen, what is something that you have done that's been a challenge, that's been hard to do, and that you've tackled? And let's talk about that for a little bit before we talk about the thing that you're paralyzed with fear about. And so I try to find some successes. And I put all that together. And then even just outside stuff, when someone's stuck, Kat, I always tell them, more important than therapy is your sleep, is your nutrition, and your exercise.
Mm-hmm.
If you're doing those things, to better your life a little bit, even if you're kind of stuck in this other area, if you're bettering your life in these other areas, you know what, we might get a small W. And the accumulation of those small W's, is something big.
That's wonderful advice because, that those baby steps, it gets them closer and closer to making movement and becoming unstuck. Sometimes it is hard, even that little baby step. I know I'm working with somebody that, I just said, go out and have coffee in the morning outside.
Hmm.
Just go outside,
Hmm.
make a small little
Hmm.
change. And I recommend this one a lot because I'm always talking about going outside nature because it is that next step to, hey, walk around your surroundings. If it's around your backyard or maybe up and down the block or something, it's because you're getting the exercise and you're getting out to nature and you're breathing outside, of
Yeah.
being in your home.
Hmm.
But those baby steps. So I'm gonna ask you, so, say you have a teenager who doesn't clean his room. What do you
Hmm.
do? What are your baby steps with cleaning the room?
Hmm. Hmm. You know what? Maybe it would be doing something else that involves cleaning, and see if it generalizes to cleaning the room. And it could be like making sure they kind of clean up their dishes, making sure that they, cleaning their clothes, or if they're old enough, they have a car and, taking care of that, and try to get them to have some pride about it. Sometimes, because it depends on what family culture is, because sometimes I have to adapt to a family culture because some families are like, we are super, strict about this. They have to have a very clean room. Other parents are like, you know what, I'll give a little freedom. It's upstairs. As long as that door's closed, I don't have to look at it. I'm going to be fine. So if they're more on the strict side, excuse me, I'll say, okay, you first have to start with creating clear expectations. Then the second thing is you have to let them know what are the consequences if they don't meet that expectation. And I don't want to create like absolute war, but I do tell parents, I go, you do have to have, like, if it's the rule that you have to clean the room and there's no consequence, then there's really no rule. Because I have parents who say, oh, we got this rule, this rule, this rule. And I'm
Right,
like, okay, so what happens? And they're like, well, we yell at them a lot. And I'm like, okay, they'll put up with the yelling if they get out of cleaning the room any day.
right.
But if you say, hey, one of my favorite things, and my daughter still tells me how often I use this one excessively, but one of my favorite things is saying, hey, listen, I'll just grab this phone, and as soon as you're done cleaning your room, you'll get your phone back. And so what you're doing, what I call, it's a negative reinforcement versus a punishment, because a lot of times parents get stuck in punishments, and they'll be
Hmm.
like, you didn't clean the room, so you don't get the computer for the weekend. And then they're like, okay, the kids might go scorched earth mentality and go, okay. And I've had kids who like hid their parents' computers or grabbed their parents' car keys and hid them, and like
Oh,
they'll just go
yeah.
like, I'll get you back. And now it's a power struggle. But if you say, hey, listen, you're going to get your phone back, but then the power is in your hands, it will happen as soon as you're done completing that task. And so now it's kind of like a reward for completing that task. And you just go, hey, I used to do that. I remember my son forgot his PE clothes for days, and my wife was arguing with him, and she was like telling him, and it's, you got to bring him, got to bring him. And I said, Matthew, hand me your phone. And he goes, why? I go, you're going to see this as soon as you bring the PE clothes. You know how many days it took him before he brought his PE clothes? One day.
Of course,
He
one
brought them
day.
the next
Hmm.
day. And it was less palaver, less threats and less nagging. And it's just like, here, it's up to you. If you want your phone, bring home your stuff.
That's true. I like that one.
Hmm.
What do you do? Let me just ask you one other question with that. What do you do with a child that doesn't work with? Maybe they're struggling with ADD. Is there another
Hmm.
technique that you could use where a child struggles even more? Like even that to try and get around that?
It's funny. It's a great point. I'm glad you brought it up because a lot of times parents are asking, "Hey, what are reasonable expectations for my ADHD kid?"
Hmm.
And I say, "Well, don't give them three or four directions, and while they're playing a video game, and expect them to hear you. Follow those directions, remember those directions, and feel they're important." Because that's the thing. You can't just say, here, go do XYZ, if neurologically they don't even have the picture of what that clean room is. Like, I actually have some kids who we have to take a picture of a clean room and put it up on the wall and go, hey, you need to make your room look like this.
Right.
Because neurologically they're so disorganized, that they can't, see it. So that's one. So make sure that the kids have the skills to do what you're asking them to do. Don't set them up to fail. And I get a lot of parents who will be like, my kid's just lazy. They could sit on, YouTube for hours, so they have an attention span. I'm like, Okay, that's
Oh,
a
it's
very
different.
different
Yes.
intentional, demand than saying go read Moby Dick. That's
Right.
just
So
those are
true.
two different things. And so I always tell parents, make sure your kid has the skills and ability to do it. And then, what you try to do is increase the motivation to get some of those things done. Like I said, withdraw things until they comply, and show them. And sometimes I'll even tell parents, I go, hey, I know you don't feel like doing this. Go in there and say, hey, listen, let's do this together. Let's do your room real quick, and it's like, let's make dinner together. And like what you do is you're modeling and you're showing them. And guess what? You're killing two birds with one stone because now you're getting a little bit of time with your teenager who doesn't want to spend any time with you.
So, what do you think some teens and families can do on their own if they're not in therapy and they're not working with somebody? What can they do on their own?
It's funny, like I said, I love giving parents lots of tools to put me out of work. I was just talking to someone this morning and I said, hey, you're a great co-therapist, doing all these interventions at home. So a few things. One, like I told you, let me pick the low-lying fruit: exercise, sleep, and nutrition. In fact, I was reading an article on sleep that it was actually an article on ADHD, and it said that we're in some ways misdiagnosing ADHD, saying it's an attentional issue, when there's some research that's saying it's a sleep deprivation issue,
Right.
and that their brain isn't fully on the grid. And so, and you actually find a lot of kids who have ADHD have trouble falling asleep and having quality sleep. So I just can't emphasize enough that your mood, your cognitive abilities, your physical abilities, I mean, you lose a big percentage of your immune system if you're not sleeping well. So sleep is huge, exercise, and nutrition. Social like connection, that's another thing that puts me out of work quicker. Is like making sure that everyone, they're communicating well, you have good relationships. A lot of times I'll tell parents to have kids have good mentors, good coach. Like my son, he talked to his Spanish teacher, and he had a really close relationship with his Spanish teacher in high school. In fact, he took him to church one time, and I thought this was great, because he had someone that he could talk to, and I thought that's just fantastic. So sometimes having good mentors builds resilience. Sometimes faith, people in their faith, whether, some certain religions and things like that, and they find, good solid faith, and that can help with resilience. The other thing, what I tell parents to do is don't save your kids all the time. We're finding a lot of times kids, they're like I was talking about, their comfort zone is getting super narrow. And a lot of it has to do with the parents aren't tolerating kids, being uncomfortable. And
Right.
discomfort actually builds muscle, emotional muscle. And so I would say if there's one thing that you do as a parent to help your child deal with the big bad world is get them to get out there, and to experience life. Like I'll share another story. One time, it was one of the first boys my daughter liked, and this kid I knew had red flags all over the place, Kat. I was like, this guy is gonna just destroy my daughter. And instead of saving her, I go, this is a great life lesson because she's going to learn what guys are capable of,
Right.
and I will pick up the pieces. And I kind of watched it go through its process. She came back, days, weeks later, crying about it, and I go, okay, what did we learn from it? And I sat with her and I
Right.
comforted her, and I helped her see it, because that life is a better teacher than we are, as
Sure.
parents. And so it's just you have to help them see it, and to be able to expand and grow from it. So I'd say those things are a lot of things.
That's great because it's true. Oftentimes, your knee jerk reaction is literally just yank your kid out from walking into the fire. And in some
Yeah.
situations, it's absolutely great. And it's not that you're not telling your kids, "Hey, here's some warning signs," but you give the warning
Hmm.
signs. Sometimes they got to walk down the path anyway,
Yeah.
to kind
Yeah.
of see what it's like. One other thing I want to say is on the nutrition part. I think
Hmm. Hmm.
that is something that a lot of people don't look at, and especially
Yeah.
in America, we have so
Hmm.
much crud in our foods. And a lot of
Oh,
that
so much.
crud, right, is in the
Hmm.
kid-friendly food.
Hmm.
I was now I didn't deprive, but I was very, very strict about what my kids ate when they were little. And I still am.
Hmm.
I'll make a comment
Hmm.
like, hey, does that have red dye 40 in it? Because all of these preservatives and additives, and especially those red dyes and blue
Oh
dyes
yeah.
and yellow dyes, they do set off kids with ADD, and it's not great for any kid. Well, it's not great for anybody's brain. But,
Hmm.
through my travels abroad, I went into this one candy store and they had an entire wall of the brand Haribo. It's that,
Hmm.
like gummy bears and the peach,
Hmm.
whatever rings or whatever they are. And I walked up and I thought, they don't look as bright. So I
Hmm.
walked up and I literally started looking and reading the backs of all of these. Not one package had anything that was a preservative. There was nothing
Yeah.
there that was a dye. And I asked the woman there, I said, wow, there's nothing with dyes. Oh, that's not allowed. That's illegal in this country. And I just thought, okay, they make it without the
Yes.
dyes for that country,
Yeah.
but in our country it's allowed. So as parents, we need to be very diligent because those things can set off behaviors. And I try to always use this example because sometimes behavior can be a result of maybe an allergy. So it's not, I'll just put it this way. I had this child that came in and parents saw it, teachers saw the behavior that would go along with an ADHD diagnosis.
Hmm.
So
Hmm.
I recommended that they went and got food allergy tested just to make sure,
Hmm.
because they instantly walked in and said, "Okay, we need to get him in therapy. We need to get him medicated." I said, "Okay, well, let's just look at everything first." Again, spoke to the teacher, confirmed everything. Found out that he was highly allergic to wheat and dairy.
Hmm.
And his go to in the morning was, frosted mini wheats with milk. And his
Hmm.
snack when he got home was frosted mini wheats with milk, which normally you would say, okay, at least he's getting the wheat in there and he's getting milk. But the allergy manifested more behaviorally than it did, say, a stomach ache or, something greater. So we've got to take a look at what's going on with foods.
Oh yeah, I had a similar situation. I had this 8-year-old girl who like was probably top 10 challenging girls, that
Yeah.
I'd seen in my practice. She literally run out of my office and ran into the street and things like that. I mean,
Oh,
she was
wow.
like had all sorts of things going on that was just off the charts. And I talked part of my collaboration. I was talking to the pediatrician. I'm like, "Hey, have you done a series of tests? Can you check out to see if she's gluten intolerant? Because maybe because I've thrown everything at this girl and then nothing's working." And she was, and they got her off the gluten, and literally
Different
like it
child.
was a different child. And I was like, wow.
Right.
And so we just don't realize, especially to your point in America, there are so many things we put in food that is banned around like 90% of the countries on this
Right.
planet. But we think it's a good idea. And I see kids show up to my office with, Takis and colored,
Oh, like
electrolyte,
blue.
Gatorade. And and I tell the parents, job security for me, because watch, they'll get activated and then they crash. It's the crash
The
that really,
crash.
that really gets these kids. So I tell parents, I go clean out, all the crud out of your cabinet and just eat clean because your gut health
Right.
and allergies and things like that and reactions. One of my favorite TED Talks was a psychologist who had a dysregulated kid who was about 6, and she found out all the yellow dyes, cause dysregulation. The red dyes cause this, and the blue dyes
Yes.
cause this, and even the medication, the ADHD medication, had a blue dye in it. She was like, "This is
Oh, I
crazy."
know. It's you do when you look at medications. Why does the
Hmm.
pill need to have a color? You know, it
Yeah, it's
it
funny.
it just doesn't make sense. But we do. We
Yeah.
put so many different things in. So, as parents, we have to be careful what it is that we're giving our child. Now, the other side of it is you don't want to deprive. You want to show kids how to eat clean. And every once in a while, if you want to have something, you can, but that doesn't become the habit. But you have to be careful because sometimes that one bite can get you back,
It can.
reaching
It really
for,
can.
the 20 bags of, Takis and things like that. So, well, that can be a whole other episode too about what's in our foods and everything else and how it affects our kids. Okay, well, Chris, this has been wonderful. I really have admired your practice and what you've done for years. I love that community approach, and you've given so much valuable information today. I am going to follow up because I do want to do a separate episode just on AI and bring in the other gentleman as well. The three of us can have a discussion about what we're seeing more with children, because I think that isolation factor is such a huge thing. And they're becoming friends with their ChatGPT, their AI, and some of it can be great. There can be value, but it's taking away critical thinking, and there's a lot of pitfalls that you mentioned today with, problem solving and not seeing the consequences. So I think that's going to be another one that will be.
I look forward to it.
Yeah, I think that'll be a wonderful discussion. So thank you so much for joining today.
Thank you for having me.
Yes, of course. This has been wonderful. So thank you so much for joining us today. Chris Fulton is located in Calabasas. And when we air this episode, you will absolutely see information on how to get to Chris and his group of practitioners in Calabasas. So be mindful about what's going on with your teens. Ask questions. See what's going on. You don't want to be the nag. You don't want to be the enforcer all the time. But know what's going on with your child. Take that time. That isolation can really be damaging in a lot of different ways. When they were little, we wanted them to learn how to self-soothe, how to play by themselves, and all of those things. That is still great, but not to the point where it can be harmful. And these are just things that we're looking at. And there's so many other things that we can talk about and look at. And if you do see that there's some things going on with your child, reach out to somebody, get some help, because that can just kind of change the trajectory of what's going on with your child and their happiness. I always say we're as happy as our saddest child. So let's do what we can as parents to get the help that they need. Thank you so much. If you have any questions or thoughts, chatwithdrkat.com. Let me know. If you'd like to be a guest, let me know, and we'll go from there. Have a great rest of your day. Bye-bye.